well, that's our official start time. So I will properly open our webinar. Thank you to those of you who've been waiting patiently. My name's Dr. Chandrika Gibson, and I'm here at Breast Cancer Care WA. We're hosting today the fabulous Dr. Emily Jeffrey, who's an accredited practicing dietitian and a researcher and a leader in the space of nutrition and cancer. We're going to hear from Emily about lots of fascinating areas around nutrition for people living with and beyond breast cancer. But before I hand you over to Emily, I would like to acknowledge the traditional owners of the lands that we're meeting on. I'm streaming here today from Whadjuk Noongar Boodja, and I offer my deepest, humblest respect to the elders of the past and to all First Nations peoples everywhere. I hope that for you, in the space that you're in, you can also connect to the earth that you're on and remember the great history of the place that you're in. As far as the kind of technical stuff today, you can already see that I didn't set up the waiting room correctly, so you're already in, but that's fine. Welcome. If you have questions throughout the presentation, you should be able to navigate to either the bottom or the top of your screen to the Q&A box. Some people will have both Q&A and chat. I'll look at both, but for most people, the Q&A is the box that will work. So if you have questions as Emily presents, pop them into that Q&A box, and at the end, Emily will address anything that wasn't already answered in her presentation. So with all of that said, let me hand over to you, Dr. Emily Jeffrey.
Thank you, and thank you everyone for having me here today to present on nutrition for people living with breast cancer. I thought I would start by giving a little bit of a background to myself so you understand where I'm coming from. I am currently working as a lecturer at Curtin University, so I teach in the Master of Dietetics program here and also coordinate the course. Alongside that, I do some research, mostly in the area of cancer and nutrition. Prior to joining Curtin, I worked as a clinical dietitian. So I worked at Sir Charles Gairdner Hospital for nearly 10 years, and I worked across a variety of different areas during my time there, but spent quite a bit of time working with people who have cancer, both as inpatients and in the outpatient space there. So today I bring a bit of my kind of practical perspective from being a dietitian alongside my research knowledge as well. So I'm going to go through the slides that I've prepared today, and then at the end, if there are questions, I'd be happy to talk through those. So let's get started. I'm hoping I can click between my slides. There we go. And I'd also like to acknowledge all First Nations people of this place we call Australia and pay my respects to elders past and present. So today I am going to be talking about a couple of things. So I've kind of split this presentation into two parts, if you like. So I'll start by talking about the current dietary recommendations for people living with breast cancer. And then following that, I'll talk through some emerging areas of research, including the gut microbiome, the ketogenic diet, and calorie-restricted diets. And I think that's where most of people's questions tend to come into things. So to begin, I think it's useful to talk about why people should consider nutrition following a diagnosis of breast cancer. The first reason that dietitians typically encourage people to consider nutrition is that eating well is something that you can do to look after yourself. Whether that's before, during, or after cancer treatment, eating well is really important for helping you to maintain your muscle mass, which helps you to stay strong and maintain your independence and activities of daily living, and also keeping strong, or we also call it being well nourished, can help you to improve your tolerance to treatment, improve your immune system, and help even repair damaged tissues after treatments like surgery. So that tends to be the primary reason certainly in my past work experience that nutrition was important to consider. If you've finished cancer treatment, eating well might also be something you can do to reduce your risk of developing other cancers or of developing chronic diseases such as heart disease, which we know can be common after cancer treatment. The last point I've got on the slide there is the potential that nutrition could be used potentially as an adjunct to treatment to help improve treatment outcomes. So that's what I'll talk about towards the end of the webinar. So I've mentioned that there are many reasons that people with breast cancer should consider nutrition following their diagnosis and across their journey. So I thought I'd start by talking about what the current dietary recommendations for cancer are, and this applies also to breast cancer. I thought I'd make also the point up front that the information that I'm presenting today is of a generic nature, and dietitians will individualize recommendations according to individual circumstances. So different people will likely receive different advice from a dietitian because of those different circumstances. So the information today is quite general. If you've got specific questions or specific concerns about your individual circumstances, then that's when seeing a dietitian in that one-on-one setting might be helpful for you. Okay, so I guess getting back to that. So as a dietitian, I typically base my recommendations on whether someone is malnourished or at high risk of malnutrition or not, so that the well-nourished person. So malnutrition is a condition where we observe loss of weight, loss of muscle, and loss of body fat. And that can be due to a reduction in food intake. And it can also be something that comes about as a result of the cancer itself releasing some chemical messengers that send signals to the body to break down muscle and fat. And we know that malnutrition can negatively affect a person's health and their well-being. So if malnutrition occurs, it's really essential that it's addressed. Typically, the risk of malnutrition is different according to what cancer you've been diagnosed with and what treatment you're undergoing. So, for example, people who have head and neck cancer or advanced cancer are more likely to have malnutrition. So with head and neck cancer, for example, that can get in the way of someone eating enough and therefore lead to weight loss. Or in advanced cancer, that is a situation where you might be more likely to have those chemical messengers sending the signal to break down the muscle and the fat, leading to weight loss. And also the kind of treatment that you have can impact on your risk of malnutrition as well. So people who are having combined chemotherapy and radiotherapy may end up with a range of symptoms that make it difficult to eat and drink. So as I said, the dietary recommendations differ for different situations. If for example, someone is malnourished, then the dietary advice tends to be around. So if someone has lost weight, then it's an indicator that they're not eating enough food to meet their body's needs. And so the dietary advice then tends to be around helping people to get enough food in. And that can be through making different food choices, like choosing foods that are higher in energy and protein. So for example, full-fat dairy products, meat, eggs, nuts, seeds, legumes, and eating more frequently across the day can help people to meet their body's needs in terms of nutrition. So what I'd really suggest for people who have lost some weight without trying or are having difficulty eating, that is a good point to seek the advice of a dietitian and get some individualized advice there. So that's my first point. So as dietitians, one of the things we'd be mindful of is this risk of malnutrition, and providing a different kind of dietary advice for people who are struggling with eating, that's really based on eating more calorie dense, protein dense foods. In terms of malnutrition risk and breast cancer, this slide here is from Peter Mac. So the Peter MacCallum Cancer Centre have developed what they call the Can Eat pathway for patients and carers. So they've put together information sheets for different cancer diagnoses to provide information about what people can expect in terms of the nutrition impact of their cancer and their cancer treatment. So with breast cancer, we've got this figure on the left-hand side here, and it says low likelihood of dietitian assistance. So in comparison to some of the other cancer diagnoses, people with breast cancer are less likely to need dietitian assistance for managing malnutrition. So people with breast cancer are less likely to become malnourished. Although in saying that, it's still really important to be aware of and monitor your weight. And if you do lose weight unintentionally, or you're eating less than usual, that you seek advice at that point in time. So as I said, malnutrition in breast cancer tends to come up less often than for some of the other cancers. The figure on the right shows common nutrition issues that can come up for people with cancer. So things like fatigue, appetite changes, nausea and vomiting, and weight changes can occur. But generally for people with breast cancer, the nutrition issues are a little bit different. So it can be things like increased appetite, weight gain, and bowel issues like constipation. So that leads me to my next slide, which are the dietary recommendations for breast cancer that are probably going to be what the majority of people with breast cancer should follow. So I've talked about the fact that malnutrition is something that we as dietitians get quite worried about and want to address. And that can happen in breast cancer, but the risk is relatively low. So the majority of people with breast cancer can follow these dietary recommendations that I've got on this slide here, which is simply eat a healthy diet and achieve and maintain a healthy body weight. And I know that seems really simple, and sometimes it's hard to believe a very simple message, but this is the recommendation at this point in time, and I'll talk a little bit more about why that recommendation exists on the next slide. Okay. So I will shortly talk about what a healthy diet looks like, but I wanted to provide a little bit of background to the advice to follow a healthy diet, because I know it seems very simple and people are often expecting that it's something a little bit more complicated than that. So the quotes on this slide are from a systematic review that was published in 2018, which looked at dietary intake and prognosis after breast cancer. So a systematic review is where the research available is collected and synthesized, and it's from this that our practice recommendations are developed. So as dietitians, we need, to bring together all of the research and make a judgment about all of the research in order to inform what we should do in practice. So this particular review had said eating a healthy diet following breast cancer is recommended by leading cancer organisations, and based on the limited evidence available to date, overall dietary intake appears to be associated with decreased risk of overall and non-breast cancer mortality. So cancer survivors may improve prognosis by adopting more healthful dietary patterns consistent with dietary guidelines. So that's where the healthy, balanced diet and the achieving and maintaining a healthy body weight can be supported by the evidence. The last sentence of the first paragraph I didn't read out to you. So at the moment there is insufficient evidence for breast cancer specific mortality and recurrence. So a lot of the information that I'll be presenting to you today, I will be saying things like we need a lot more research in this space to be able to guide our future practice, and that's something where we certainly need some more research. Okay, so let's move on to the next slide. So I mentioned that following a healthy diet is the recommendation that is going to be most applicable to most people with a diagnosis of breast cancer at most stages across the journey. Some of you may have seen this already. This is our Australian Guide to Healthy Eating. And it is a visual representation of our Australian dietary guidelines. So our Australian dietary guidelines provide advice on eating for health and well-being for the general population. And these guidelines are also typically suitable for people living with cancer. The guidelines reflect the fact that our bodies need a range of different nutrients to keep us strong and healthy. And so the recommendation is for people to eat a wide variety of nutritious foods from each of the 5 food groups every day. And so what I'll do, I know some of you probably have seen this already and have some good knowledge around basic healthy eating, but I thought it's still worthwhile to go through this in a little bit more detail anyway. So the figure on the slide, as I said, it's our Australian Guide to Healthy Eating. If you're not familiar with this one, you might remember a food pyramid, which was our old visual representation of the proportion of foods that's recommended to make up your daily food intake. So essentially on the Australian Guide to Healthy Eating, we have foods that are separated into food groups, and we've got our grains and cereals, our vegetables, legumes, fruit, milk, yogurt, cheese, and other dairy alternatives, and then meat, chicken, fish, and alternatives as well. So foods are separated into groups based on what nutrients they provide our bodies. So, for example, the grains and cereals group provide our bodies with a source of energy or fuel. They also have fiber, which is important for our gut health and our bowels, and B vitamins and a range of other vitamins. Whereas down in the lean meats and alternatives group, we have protein as being a key nutrient within that group, alongside things like iron and zinc. So foods are grouped together because they have similar nutrients. And then the idea is that if you have food from each of these groups every day, then your body gets the variety of nutrients that it needs for good health. The other thing to point out with the Australian Guide to Healthy Eating is that the size of the section, if you like, in the Australian Guide to Healthy Eating represents the proportion that food should make up. in your diet. So you can see here, if we look again at the cereal foods, that it represents just under a third of the circle. So roughly a third of what you eat in a day should be made up of grains and cereals foods. Similar thing applies to vegetables. It's just less than a third there. So looking at making sure the diet has plenty of vegetables, and then smaller amounts of fruit, milk and alternatives, and meat and alternatives. Hopefully, one thing that you'll notice from looking at this Australian Guide to Healthy Eating is that plant foods make up the majority of this circle. So at least kind of the 2/3. And if you choose some alternatives in these two groups, it would be even greater than that. So a balanced diet is typically not just one that contains foods from all of the different food groups, but that is mostly plant-based. So plenty of fruits and veggies, plenty of cereals. You might notice down the bottom here, we have some other foods. These are what we call discretionary foods, but you might know them as junk foods. And they're foods that have a high amount of fat, sugar, and salt. And unlike the foods that are in the circle here, these foods don't generally contain any other nutrients. So vitamins or minerals or fiber that are important for our bodies. So they aren't considered essential, and they should only be consumed sometimes and in small amounts. So move on to the next slide there. So that is a brief kind of introduction to what a healthy diet looks like. The other thing that I think it's important to draw your attention to is protein. And so protein is something that is a building block for your muscle, and it's really important for our health overall. And for people with cancer, your protein needs are slightly higher than that of the general population. So generally, we recommend that people with cancer have at least 1 gram of protein per kilogram of body weight per day. And what I wanted to illustrate on the next 2 slides is that protein intake can be achieved through eating regular foods. So to get the protein that your body needs, you don't need to go out and buy a particular product like a protein powder or anything like that. It's unless you're having difficulty with eating and maintaining your weight, and you're in that malnourished group that I mentioned earlier, you should be able to get your protein needs with regular food alone. So I mentioned that the recommendations are about 1 gram per kilogram of body weight per day. So I've got an example here of a diet that has about 65 grams of protein in it. So that would be for someone who is about 65 kilos. And so that amount of protein can be achieved by having a breakfast that has muesli with yogurt and fruit, a flat white coffee, cheese and salad sandwich, and a chicken and vegetable curry with rice at dinner. So you can see that they're all everyday foods, and eating a protein food with each meal and snack time can mean that you're able to achieve that 65 grams of protein target across the day. So the second slide here is if you were to look at increasing the protein intake to about 80 grams a day. So what I've got on this slide is in addition to what was on the previous slide. So the previous slide had 65 grams of protein in a day, and then to get that extra 15 grams to reach the 80 grams per day, something like sprinkling some linseed sunflower almond meal to breakfast, adding in a slice of toast with peanut butter in the afternoon, and then having a dairy dessert in the evening would is enough to get that 80 grams of protein per day. So yes, having enough protein in the day can be achieved through eating regular foods in people who aren't having any difficulties eating. So that's really the end of the kind of current recommendations for eating with breast cancer. So just to reiterate, it's having a healthy diet, achieving and maintaining a healthy body weight, getting enough protein, which should be achievable through eating regular foods, and then monitoring your weight. And if you're having unintentional weight loss or difficulties eating, then seek the support of a dietitian to help you with those strategies to get enough food across the day. So the next part of the presentation, I wanted to go into the more emerging areas of research at the moment, and to give you a little bit of an update here. So I'll start with the gut microbiome. So this refers to the microorganisms that live in your digestive tract. So it includes things like bacteria, viruses, fungi, and other microbes. So we know that the gut microbiome plays an important role in many aspects of health, and specifically in breast cancer, there is some research at the moment looking into how the gut microbiota may play a role in the development of breast cancer and whether the gut microbiome could influence the response to breast cancer treatment. At the moment, the research is very early on, and so there are many questions still to be answered, but I thought it would still be good to go through diet and the gut microbiome. So in terms of what can affect the gut microbiome, there are actually a range of different factors that can affect your gut microbiome. So diet is a common one that springs to mind, but there are lots of things that can affect it. So things like medications, particularly antibiotics, where you live can affect your gut microbiome, your life cycle stage, the birthing process, so whether you were born via a cesarean section or not, whether you were breastfed or not, and then stress can also play a big role in impacting on the gut microbiome. So exercise stress, metabolic stress, and psychological stress. So it's important to keep in mind that diet is just one of those factors that can impact on the gut microbiome. That's obviously the one that I'm going to talk about today because of my background, but there are other things that will impact on it as well. And maybe I'll go back. And I think the thing with the research at the moment is that, we don't know how well the diet can modify the gut microbiome, and whether that will result in improvements in treatment outcomes. So that's there, lots of the questions that we need to continue to research. So looking at diet specifically in the gut microbiome, there are different things within the food system that we can consume to influence the gut microbiome. So they can be called different things. So a prebiotic you might have heard of, and that's the non-digestible part of the plant, so the fiber. And that's something that serves as food for good gut bacteria. And so if the good gut bacteria have food, then that can really improve the health of the gut. There's also probiotics, and so that is delivering live beneficial bacteria to the gut. So prebiotic is food for the bacteria. Probiotics are the actual bacteria, live beneficial bacteria. And then we have symbiotics, and that's a combination of prebiotics and probiotics. So prebiotics can come from a range of different places in our diets. And so I've separated them out here. So prebiotics are things like inulin, fructooligosaccharides, galacto-oligosaccharides, resistant starch, and pectin. And so examples of foods are things like artichoke, asparagus, chicory root, garlic, green banana, onion, wheat and rye, legumes, cooked and cooled potatoes, apples, and citrus fruit. So there are a range of different foods that we can eat that will help our good gut bacteria really thrive. And I feel comfortable providing this advice, even though we don't have a lot of research in relation to the gut microbiome and its impact on breast cancer or breast cancer treatment, because I think this advice is really in alignment with a healthy, balanced diet anyway. So the foods that are good for our gut health are, the grains, the vegetables, and the fruits, and the things that are really promoted as part of the healthy, balanced diet anyway. So if you're having a healthy, balanced diet with plenty of plant foods, then you're likely to be getting these prebiotics that are good for your gut health. So the dietary probiotics can be separated again into different categories. So we have the fermented dairy products like yogurt, kefir, fermented vegetables like sauerkraut and kimchi, your fermented grains and legumes like sourdough bread, tempeh, miso, and fermented drinks like kombucha. So these contain live bacteria and again, having these foods in your diet could potentially improve your gut health. When it comes to probiotic supplements, I've had a look at some of the research in this area. There does seem to be some evidence that probiotic supplements can help with diarrhea associated with chemotherapy. So there are a few different strains there that seem to be used in the studies. One of the limitations, I think, of some of the research is that many studies have used a 4-week time frame to monitor outcomes, but it's been noted that people may need to be taking probiotic supplements for longer than that to see the beneficial outcomes. So yes, it does seem like there is some evidence to support probiotic supplements in terms of managing some of the side effects of chemotherapy. Some things to be mindful of are that probiotic supplements are usually not recommended in people with a weakened immune system. So similar to any other supplements or medications that you want to take, I really recommend discussing probiotic supplements with your doctor, and then they can assess your individual circumstances and whether that may be helpful for you or not, or appropriate for you. So next, moving on to some different diets, and firstly, the ketogenic diet. So there's been a lot of recent interest in ketogenic diets for people with cancer as a possible approach to selectively starving tumours. So ketogenic diets actually have a long history in being used as a dietary treatment for epilepsy, but are seeing kind of a new interest in the cancer space at the moment. So a ketogenic diet is a diet that is very high in fat and very low in carbohydrate. And that manipulation of the macronutrients is designed to induce ketosis, which is where the body uses the fats for energy or for fuel instead of glucose. So I thought I would present some of the research in this area. So this is a study that's looked at survival outcomes following a ketogenic diet. So this was a randomized controlled trial which included 60 women with locally advanced breast cancer undergoing neoadjuvant chemotherapy. And I've got two ands in there. And it also included metastatic, those with metastatic breast cancer undergoing chemotherapy. So the intervention in this case was a ketogenic diet that included medium chain triglycerides. You can consume medium chain triglycerides. You can purchase them and consume it as an oil. And I think the reasoning behind that is that it can help to induce ketosis sooner than a traditional ketogenic diet. So I suspect that's why that was chosen in this particular case. But you'll see that the intervention group, the carbohydrate intake was very low at just 6% of energy intake. 19% protein and then 55% fat. And the control group had a diet that was 55% carbohydrate, 15% protein, and 30% fat. And that's what you would typically get from a balanced diet with a little bit of variation there. You can see the big contrast there, mostly that real reduction in the carbohydrate intake and the increase in fat. So participants in the study followed the diets for 90 days and 3 out of 4 people adhered to the diet. I think one of the concerns with a ketogenic diet has always been worries around how that could impact on people's blood lipids, their kidneys and their livers. The study reported no significant adverse effects with regards to those things. And they also reported a significant decrease in body mass index. In some cases, that might be a beneficial effect, certainly if you're looking to achieve and maintain a healthy body weight. In other cases, it may mean weight decreases, below a healthy range, and so may be of concern. So the outcome of that study was that the researchers did find there was a significant difference in overall survival in the neoadjuvant chemotherapy group who followed the intervention, but not the metastatic cancer group undergoing chemotherapy. So this was the one randomized controlled trial I could find specifically in breast cancer that looked at survival outcomes. So there's a lot more work to be done in this area, but it does present, potentially something that, or a way that nutrition can be used as an adjunct to treatment potentially in the future. The other kind of diet that is being researched at the moment, or the dietary pattern, if you like, are the calorie-restricted diets. And there are lots of different types of calorie-restricted diets. So the first one is where you can reduce daily energy intake by somewhere between 15 to 30%. And there are those fasting diets, and that usually looks like restricting over 50% of usual calorie intake, or it can be where you restrict or limit eating to a certain time window. So we call that time restricted feeding. So eating might be limited to 6 or 12 hours in a day. And then the third one is the fasting mimicking diet. So that's a low calorie diet, but also one that is low in protein, low sugar, and is based on plant-based foods. And that's where the research is being done at the moment. So the calorie restricted diets are designed to induce starvation, and that is that can lead to changes in the body's metabolism and may influence the immune system, which is how it may be helpful as an adjunct to traditional cancer treatments. So I'm going to present a couple of studies on calorie restricted diets. They're both fasting mimicking diets. So the first one was a 2-direct study that included 131 women with HER2 breast cancer during neoadjuvant chemotherapy. So the intervention was, as I said, the fasting mimicking diet. So the way that this works is that it's the fasting mimicking diet is done kind of the 4 days at the beginning of the chemotherapy cycle. So day 1, a person in this study in the intervention would have a diet of around 1,200 kilocalories per day with more carbohydrate compared to protein and fat. And then days 2 to 4, intake decreases to around 200 kilocalories, with carbohydrate making up most of the energy intake. And then the control group consumed their regular diet. So I think one of the interesting outcomes from this research was that only about 1/3 of participants in the intervention group were compliant for half of the cycle. So people found it really difficult to adhere to the fasting mimicking diet. Importantly, chemotherapy toxicity didn't differ between groups, and there was a significant difference in patients with a response to treatment in the fasting mimicking diet group. So yeah, that there was some good outcomes in relation to response to treatment, but the majority of people found it really hard to adhere to that fasting mimicking diet. This is the second study that looked at a fasting mimicking diet. So this wasn't a randomized controlled trial, but they looked at historical controls, so controls from the past. And it was actually a larger study that looked at lots of different cancer groups, but then they've done an analysis just on 90 people with breast cancer. So their fasting mimicking diet was for 5 days. Again, day 1 with a higher energy intake, and then days 2 to 5 with much lower energy intake. And that was done at the beginning of each chemotherapy cycle for up to 8 cycles. This study reported better adherence, so 71% adherence, and average BMI loss of 4%, which stabilized or recovered over time. So as I said previously, sometimes that BMI loss can be wanted, and other times it can be unintentional, and that's really something to be mindful of. And so the outcome was better overall survival at 40 months in the fasting mimicking diet group compared to the historical controls. So some studies with some promising outcomes, following those fasting mimicking diets. So in summary, with regard to the ketogenic and the calorie restricted diets, there's a range of non-human studies that show that ketogenic diets, fasting and fasting mimicking diets can enhance the effects of traditional cancer therapies. But we have at the moment a lack of controlled studies in humans. So we don't have a lot of evidence, enough evidence certainly as a dietitian practicing to be able to recommend these diets in practice until we get some more more studies. Things to be mindful of is that even when we get more studies down the track, these kinds of diets are not going to be suitable for everyone. So it might not be suitable for people with kidney disease or diabetes or those who are at risk of malnutrition. And I think being mindful of some of the side effects that these diets can cause as well is important. I think one area that really needs to be addressed in future research is how to make it easier for people to follow the restrictive diets. So I'm not quite sure what the answer is there, but yeah, how can we help people to follow the restrictive diets if indeed they are beneficial? Yeah. From my perspective, that would be something helpful. If I'm thinking about dietetic practice in the future, and if I'm going to be in the future recommending this diet, how can I help people to follow this advice? Okay, so that brings me to the end of my presentation now. So in summary, I've said at the beginning that a balanced diet consisting mostly of plant foods is recommended for most people with breast cancer. People with unintentional weight loss or difficulties eating should seek support from a dietitian. Dietary manipulation of the gut microbiome, ketogenic diets, and calorie restricted diets may play a role in enhancing the effects of cancer treatment, but much more research is needed before these diets can be recommended as part of standard nutrition care. There's some references, and now I'm ready for questions. Thank you.
Thanks so much, Emily. Wow, there's a lot to think about, a lot to digest. I can see that a couple of questions have come into the Q&A box, so let's open that up. The first question from Emmy is about protein powder. Can you use protein powders in shakes to add more protein?
Yes, so yes, a protein powder can be used to add more protein to your diet. I would say though that it's likely that you can get protein from regular foods without needing to purchase a protein powder. So I'd try having more protein through the food choices that you make. Before looking at a protein powder. So, I mean, for one, it will potentially save you money by looking at some other sources rather than buying a product. And also, I would say using a protein powder is probably limited to people that are really having difficulty eating enough due to the side effects of their treatment and so on.
Sure. The next question is similar, and I had the same thought. A lot of people are talking about doubling that amount of protein. So rather than 1 gram per kilogram of body weight, people are talking about doing 2 grams per kilogram of body weight. Is there
Mm,
any risk to getting your protein up that high?
mm. Yeah, it's a good question. The guidelines do say up to 2 grams per kilogram per day, but I suspect that that is for, I would think my interpretation of that is that the higher end of the range would probably be for um, maybe malnourished people, or yeah, that would be my primary thought. The risk of having too much protein is, it can impact on your kidneys, for example. So long-term, very high protein intake. So that would be something to be mindful of. Yes, so I personally don't feel like double that. I don't feel like 2 grams per kilogram per day is necessary for most people. It may be for some. I would say probably towards the lower end of the range.
Okay, thank you. Linda asks, are there any particular recommendations for those on targeted therapies for triple negative breast cancers?
So not that I'm aware of. So I think I I don't think we've got enough research at this point to really narrow it down to that level. I think, as I mentioned before, the systematic review for dietary recommendations was really just overall for breast cancer. Hopefully, in the future, we would get to a stage where we might have some different recommendations for, different um, breast cancer diagnoses, but I don't think we do have that at this stage. But in saying that, different diagnoses may mean that there are some different nutrition issues that come up, and that could obviously be addressed on an individual basis with a dietitian. But in terms of overall recommendations, there's nothing specific.
Well, we'll keep our eye out for studies where they are kind of getting more tailored to different tumor types and different
Mm.
treatment types as well. What about caffeine? There's a question about whether caffeine affects
Mm.
breast cancer at all.
I don't know the answer to that one. I'm sorry. Just trying to think if I've heard of anything. Nothing comes to mind. I'm sorry.
I know that I read some years back that coffee drinkers had a lower risk of colorectal cancer. I think that might be to do with how it kind of stimulates peristalsis, but I haven't seen anything specific to breast cancer either. Another question here is about hormone treatments. Many breast cancer thrivers, people living well with metastatic breast cancer, are on a daily hormone treatment. Are there any dietary recommendations to support those hormonal treatments?
I think I feel like this question is maybe similar to the other question around specific treatments or specific types of breast cancer. Um, and again, I'm not aware of any specific recommendations in this case.
Sure. What about multivitamins? Is it okay to take multivitamin tablets?
I think it's generally safe to take multivitamin tablets, although, as I said with the probiotics, I always suggest any supplement to discuss with your doctor. But generally, I think it is safe to take multivitamin tablets. Whether it's needed is probably a different question. If you are having a variety of foods from all of the food groups, you shouldn't need to take a multivitamin tablet. And it might be another one of those situations where, yeah, you're spending money on something that is not needed and that you can get from the food that you're eating. But yeah, safety wise, I think generally okay, but maybe not needed if you're having a well balanced diet.
Mhm. I was curious in the microbiome section. I love the fermented foods and things like
Mm.
kombucha and sauerkraut, but I wondered if there was any risk in consuming live bacteria, like maybe if people have neutropenia or are immune compromised in some way.
Yeah, that's a good question. Um, I know, I mean, specifically, when I was working in oncology with like the blood cancers, many of those patients would need to go on what we called a low bacteria diet or a neutropenic diet, and those foods would be not allowed on that particular kind of diet. Um, I think there's been some recent kind of research into those showing that those diets aren't necessary. So I wonder if the food-based probiotics would be in a similar category. Um, uh, I'm yeah, I don't have an exact answer for that, but if I were going to advise on that, I would say yes, maybe be cautious around those probiotic foods around the time that you are likely to be neutropenic. Um, that would be my cautious response to that. I don't think that there's much research to guide me with that particular recommendation.
Mm, mm. It is tricky, isn't it? And I love that you're answering a lot with I don't know or there's not enough research yet. Yeah, I hope our listeners are understanding that this is all emerging science and it's so fascinating. But for each individual, we kind of have to balance our own risks and make, well-informed judgments where we can. There's a lot more questions. I'm just seeing them all flooding in, Emily. Next question is there any risk with consuming red meat with cancer?
Having red meat is associated with developing some kinds of cancer. Having large amounts of red meat are associated with developing some kinds of cancer. So in our general recommendations, we would say have a diet that is mostly based on plant foods and limiting red meat consumption. I don't know about if you have a diagnosis of cancer, how that would then impact on that. I think the research is more in terms of how it could affect the development of cancer.
Mm,
But yeah, I certainly think that as part of a healthy, balanced diet, I'd be focusing on plant foods and limiting red meat, not cutting it out altogether, but limiting it to a couple of times a week, for example.
yeah. There's a comment around steroids and how those corticosteroids stimulate the appetite to make it kind of
Mm,
insatiable. And then when
mm,
you come off them, you might not have an appetite. Any
mm.
nutritional kind of insights around that?
Yeah, that's a really hard situation. Um, I think that is probably the main thing I would reinforce, that that's a really difficult situation. So I think that the concern around having a very high appetite during those periods of taking steroids is that that would contribute to weight gain over time, which is not what we would want. So so managing the appetite would be about kind of limiting how much weight is gained over that period on steroids. My main suggestion there, and I don't know how helpful it is because obviously the hunger sensations are very strong, but it's, when you are feeling hungry, to try and snack on those lower calorie foods, the veggies in particular, to fill up on those rather than other foods. But again, I think that's easier said than done. Um, and yeah, having no appetite now, I think, would be a situation where you almost need to do the opposite. So when you've got really ravenous appetite and you're worried about gaining weight, having lower calorie foods to fill you up would be the best solution. If you've got no appetite, you're at risk of weight loss. So doing the opposite and having higher calorie foods and more often is really what the advice would be.
Yes. Now, the last few questions or comments are a little bit around advice that people are given while they're going through treatment. Michelle talks about her nausea during chemo and
Mhm.
being told to just eat whatever she can, get something into her, and then at the end of chemo treatment to go back to healthy eating. And she's asking you, have you heard of that? Is it better to eat something rather than nothing at all when you're nauseous?
Yes, I think that's good advice, and I would agree with that. I do think that, if you're having eating issues during treatment, it really is about getting in what you can and getting through that time period, and then, once you finish your treatment, you can progress back to a healthy, balanced diet. So, and I think, you will feel better for having just something in your stomach as opposed to nothing in your stomach from a nausea perspective. So, I think that is good, sound advice.
Yeah. That's right. We need to be nourished in some form. And
Mhm.
Lisa's just commenting on the live probiotics. She was advised not to have them when her white blood cell count was low,
Mm.
but she continued. She made a choice to have kefir and sauerkraut, etc. So I had one more question before we finish up today, Emily, which is around those calorie restricted
Mm.
diets. And is there a risk that this becomes, something that could trigger old patterns of disordered eating for people if they have a history like that?
Yeah, that's a great question. And yes, I think that there is potential there. Um, and I don't think that's something that's really been considered in the research that's been done to date in terms of the inclusion and the exclusion criteria for the studies. I think it's been around, um, does someone have kidney disease or X or Y or Z, but hasn't looked at past history of disordered eating as something that, yeah, would need to be carefully considered um, when thinking about these kinds of diets. So I think that's a great point, and I don't think that I had given that much thought prior to you mentioning it, but yeah, really important.
There is one more question from Lisa, suggesting that she's seen some research papers supporting the use of ketogenic diet to reduce metastases, so reducing progression in metastatic cancer. Um, any comments on that, Emily?
Um, I can only comment from or kind of reinforce what I've said already. I think that there are some individual studies that have promising outcomes. But when it comes to practice and informing our practice, I think we're in a difficult position. Well, I don't know if it's a difficult position, but what we need is lots of research that all says the same thing for us to then go ahead and recommend a particular diet. So, yeah, I think dietitians are in the position that we need to wait for there to be more research for us to then make these recommendations. I think, there are some promising things out there, but it's too early for us to recommend them in our practice.
Yes, I understand. I'm going to let Amy's question sneak in as well, which is any recommendations on nutritional ways to maintain muscle mass, which may be talked about with the protein, but she also brings up bone density while on a calorie restricted diet.
Hmm. Um, yeah, it's an interesting one. Um, I think the long term, if you are continuously on a calorie deficient diet, then that can be more difficult to maintain muscle mass. You need to eat enough calories to maintain your muscle mass as well. So if you don't eat enough calories or energy, then your body will break down the muscle to use it as a fuel source. So if you're constantly in a calorie deficit, then I don't think that will support your muscle very well, even if you eat more protein. So yeah, my PhD research in mesothelioma, so different cancer group, but we looked at people who did an exercise intervention, and we found that people who didn't eat enough kind of calories weren't able to gain as much muscle as the people that did. So I think it is really challenging to maintain muscle when you're not getting enough calories. On like long term. If it's, a few days that you're fasting within a month, then that's probably easier to, maintain muscle. But if it's constant, that is really tricky. But in terms of how to retain muscle mass, it's the protein foods. So it's, meat, chicken, fish, but also eggs, nuts, seeds, beans, eggs, and then bone density, you're looking at calcium foods. So milk, cheese, yogurt, or your plant-based alternatives that have calcium added.
Okay, we have gone a little over time. There's another question here about Manuka honey. Have you come
Mm.
across anything around Manuka honey and breast cancer?
I haven't actually looked at any research in that space. I know that Manuka honey is supposed to be good for many things, but I haven't read the research in that space.
Yeah, fair enough. Me neither. And look, I feel like we've done a lot in this time. You've covered a lot of fantastic content. I hope that people are finding it helpful. We do understand that, generic advice can only go so far. And so we do support you going to see an accredited practicing dietitian and getting some individual advice if that's what you feel you need, or if you need to talk through some of these ideas. So we're very grateful for your time and expertise. Thank you so much for joining us, Dr. Emily Jeffrey.
Thank you
And
for having me.
for our webinar participants, this recording will get sent out. Might need a bit of an edit because I talked at the beginning. I didn't realize you could hear us. So there will be an edited version circulated. And we also have another webinar coming up in only like 10 days or so, a week or so away, on June 11th with Associate Professor Ben Smith. And he'll be talking about the psycho-oncology research around interventions to help with fear of recurrence. So if that's of interest to you and you haven't signed up, please jump on our website. It's on the Living Well page and you can sign up for that one. But for now, we're going to leave it there. So thank you all for joining us and thanks again, Emily.
Thank you.